Off day and good afternoon. The Committee on General Government Operation, Appropriations, and Housing is now called to order. For the record, today is Wednesday, May 25th, 2022. The time now is 2:02. Notice for this budget hearing were disseminated via email to all senators and all main media broadcasting outlets. First notice was issued on May 16th, followed by May 23rd. The committee will now hear Bill 276-36 COR from the Committee on Rules by the request of the I Maga'hågan Guåhan, the Governor of Guam, in accordance with the Organic Act of Guam, an act making appropriation for the operation of the executive branch of the Government of Guam for fiscal year ending December 30th, 2023, making other appropriations and establishing miscellaneous and administrative provisions relative to the Department of Public Health and Social Services. I'd like to acknowledge my colleagues that have joined me this afternoon, and we have the Oversight Chair for Department of Public Health, Speaker Therese Terlai, and Senator Dphs and Senator Amanda Sheldon. Those testifying on Bill 276 relative to the Department of Public Health and Social Services are invited to the panel, and they have been invited. We have the director and Art Agustin, and he'll introduce his folks, his staff that are present on the panel. The general rules of this budget hearing shall be as follows. Written testimony shall be submitted to the committee. Please provide my legislative staff with your written testimony for photocopying. Testimony may be read, and lengthy testimony should be summarized to about 5 minutes. But Mr. Agustin, you have pretty much all afternoon. Hopefully you won't use it all. All right? Those testifying will be allowed to present oral testimony. Once you're done, please remain in the room for questions or for additional testimony as may be desired by members of the committee. Questions and testimony shall be confined to the substance or nature of the agenda. The agenda is the budget for Department of Public Health and Social Services. Personal inference as to the character or motive of any senator or any individual testifying is not permitted. I'd ask the panel and my colleagues that if you feel that any personal inference has been placed on you, please raise your hand, and so we can recognize that and we can neutralize whatever exists. Any violation of the general rule of conduct will result in removal from the budget hearing. Proper form and decorum shall be practiced by all present in the public hearing room for these proceedings. Individuals who fail to maintain proper form and decorum will be restricted from providing oral testimony and will be escorted from the room. When you speak, please make sure that the microphone is on, that you speak into the microphone. Other questions may be submitted to the committee for submission to the agency or department for response. You state your name and your title for the record. At this time, I ask the Sergeant Arms to ask the panel to please rise. And you'll be sworn in for all your testimony you'll be providing.
Please raise your right hand. Under penalty of perjury, you all affirm that any and all information you provide today, whether it be verbally, electronically, and in writing, be the truth, the whole truth, and nothing but the truth, so help you God. Mr. Chair, you may proceed.
Thank you, Sergeant Arms. Mr. Agustin, Art, I'd ask you to introduce everyone that's on the panel, and I'd ask each panel member that when you're asked a question or you're going to answer it, you identify who you are and your position one time. After that, then you won't have to do it anymore. All right? Just so that we get the initial introduction, other than the formal introduction by Mr. Agustin. Mr. Agustin, I'd ask you now at this time to present your budget for Department of Public Health and Social Services.
Thank you very much. Honorable Senator Joe San Agustin, Chairman Committee on General Government Operations, Appropriations and Housing, Speaker Terlai, Legislative Secretary Shelton, and Senator Dphs. I'm Arthur San Agustin, Director of Public Health and Social Services. With me this afternoon are my deputies, Laurent Duenas, who is seated outside at this time, as we are, of course, limited number of people that will be sitting at the table this afternoon, but she is available should we need her to come in and provide additional information or testimony to the budget before us. Also with me this afternoon is Deputy Director Terry Uggan, and I'm just curious if we already have the slide ready to go. Is our PowerPoint here? Okay. Thank you very much. Buenas noches, Senator San Agustin and members of the committee. Thank you for giving us the opportunity to present our department FY23 budget. We provided a copy of our organizational chart or overview of our department. We will introduce our division managers and our 6 divisions. With me this afternoon is our Chief Environmental Public Health Officer, M. Thomas Nadeau from the Division of Environmental Health, to my far right. We also have with us Xenia C. Pacina, who is the Acting Chief Public Health Officer from the Division of Public Health, to Tom's immediate left. And to her immediate left is Task Archangel, who's the Chief Human Services Administrator for the Division of Public Welfare. Okay. And again, to my deputy's immediate left is Patricia Moffness, the Acting Chief Human Services Administrator for the newly created Division of Children's Wellness. And to her immediate left is Charlene St. Nicholas, our Senior Citizens Administrator of the Division of Senior Citizens. And soon to join us this afternoon, and she's coming to the table very shortly, will be Ms. Arlene Pierce, the Controller, Division of General Admin, Finance Management Services, on our business office. DPHS was created by 5GCA, Governor of Guam, Government Operations Chapter 3, Department of the Government Article 1. Our mission statement is to assist the people of Guam in achieving and maintaining our highest levels of independence and self-sufficiency in the areas of environmental health, children's wellness, senior citizens, social welfare, services provided including providing leadership and direction in diverse areas of environmental health, consumer protection, communicable disease control, vital statistics, Medicaid, Medically Indigent Program, or MIP, foster care, services for the elderly, supplemental nutrition assistance program, and various public assistance programs. Our enabling statute is provided there in our slide, also our mission statement, which I just very briefly went over, and our vision statement. Sitting with me to my immediate right is our Controller, Arlene Pierce, and at this moment I also want to take a moment to recognize Senator Tony Atta and Senator Chris Duenas. Senators, thank you. Department of Public Health and Social Services has 6 divisions. The divisions are Division of Environmental Health, who oversees the island-wide health programs and activities for the protection of health and safety of the people of Guam. Division of General Administration, who is responsible for providing policy directives, senior management, leadership, and administration, guidance to various divisions within Public Health and Social Services. Division of Public Health, who is responsible for working towards the prevention and control of diseases for promoting health throughout Guam. The Division of Public Welfare, that ensures all overall administration of social services program for Guam as mandated by Governor of Guam and SSA, Food Stamps Act, Personal Response and Work Opportunity Reconciliation. Programs include SNAP, TANF Public Assistance, EAP, MIP, and Medicaid. Division of Senior Citizens plans, coordinates, and implements programs for senior citizens through a formal support system to address their needs and challenges in an effort to maintain and attain a dignified lifestyle as practicable. And last but not least, our Division of Children's Wellness, who provides various services to meet the needs of children in foster care. Next slide, please. Our overall budget request for FY 2023, the department's overall budget request from local funds consists of a total of $70,048,517,000. The breakdown consists of $60,394,957 from the general fund, and 9.6 or $9,653,558 from special revenue fund. These amounts include DPHS total cost of operations, local match requirements for our federal grants, and other program costs. Federal grants funding source for local match is estimated to be at $75,289,418. The overall total budget request for DPHSS is $145,337,934. And that's presented here in slide 6. If we could go to the next slide, please. DPHSS has 2 major funding sources appropriated by the legislature for our general operational costs, consisting of the general fund and the Healthy Future funds. Other funding sources are from Environmental Health Fund, Sanitary Inspection Revolving Fund, Health Professional Licensing Office Revolving Fund, and the Office of Vital Statistics Revolving Fund. DPHSS also receives miscellaneous appropriations for public assistance, local match for Medicaid, Guam Cancer Registry, Enhanced Allotment Plan, Child Protective Services, Medical Cannabis Program, and for Foster Care Group Home. The use of DPHSS funds is for operations of various programs. DPHSS provides programs and services in the areas of environmental health, public welfare, children's wellness, and senior citizens. It also ensures the public's protection through preventive measures against unsanitary conditions. Recently, our island has been impacted with the coronavirus or COVID-19 pandemic, and DPHSS has been in the lead agency in slowing the spread of the disease island-wide. If we could go to the next slide, please.
Mr. San Agustin,
Yes?
before you go any further, we've got a booklet here, but what you're showing on the slides is not what we have. And I don't want to keep going down this road.
Yeah, sure.
And my colleagues are trying to figure out, where are you at? Where are you going?
Absolutely.
Are we waiting for it to be printed? If we're waiting for it to print, we'll take a few minutes to pause. Because I want to stay on track with whatever numbers you present to us, okay? Do you know where it's at right now? I hope it's not en route because we're already here. Where's it at? Give it to Sergeant Arms, we'll get copies
So
of it.
Senator, perhaps if I may, if we could move from this presentation to the division-specific presentation, will that, in the interest of time, the packet that you have, we have the division heads here, and we can start that presentation?
No, if you have copies of what you're presenting right now on the screen, we'll just make quick copies. It'll just take a few minutes.
All right, thank you, Senator, for that
All right, so
accommodation.
we're going to take a quick recess while we make the copies, so my colleagues will be fully equipped, okay? So we're at recess at this time.
Thank you.
Thank you and good afternoon. The Committee on General Government Operations, Appropriations, and Housing is now called back to order from recess. I know that we identified some of my colleagues that joined us this afternoon, but I want to make sure I covered everybody. We got the Oversight Chair, Speaker Therese Terlai, Senator Talo Tadigui, Senator Amanda Shelton, Senator Tony Ada, Senator Chris Duenas, Senator Sabina Perez, yes, and Art, Mr. Augustin. We will continue from page 7, okay? That's the last numbers, and we'll just follow your slides, and we know we have the packet that gives you a little bit of your narrative. We just want to be able to follow the slides so we know what numbers we're talking about. Okay, so we'll be on slide 7.
Slide 7. Thank you,
Okay.
Mr. Chair.
All right, thank you,
So
sir.
on slide 7, again, thank you for that accommodation, Mr. Chair and members of the committee. DPHS has 2 major funding sources appropriated by the legislature for our general operational costs, consisting of the General Fund and the Healthy Futures Fund. Other funding sources are from Environmental Health Fund, Sanitary Inspection Revolving Fund, Health Professional Licensing Office Revolving Fund, and the Office of Vital Statistics Revolving Fund. DPHSS also receives miscellaneous appropriations for public assistance, MIPPR, local match for Medicaid, Guam Cancer Registry, Enhanced Allotment Plan, Child Protective Services, Medical Cannabis Program, and for Foster Care Group Home. The use of DPHSS funds is for operations of various programs. DPHSS provides programs and services in the areas of environmental health, public welfare, children's wellness, and senior citizens. It also ensures the public's protection through preventive measures against unsanitary conditions. Recently, our island has been impacted with coronavirus COVID-19 pandemic, and DPHSS has been the lead agency in slowing the spread of the disease island-wide. If we can go to the next slide, please. Included in the FY23 budget are the hiring of critical positions within DPHSS and other costs that are essential to our operations. Most of DPHSS's operational costs are labor costs for normal operations under the DPHSS mission. Part of the labor cost includes responding to the coronavirus operations as a result of the public health emergency. We have kept these costs to a bare minimum. Other operational costs include contractual services, office leases, fuel, supplies, utilities, and miscellaneous costs. Miscellaneous costs include payments to foster parents and payments made to recipients of Medicaid providers, MIP and public assistance programs for the local matching share requirement of the federal grants program funding. Slide 6 below summarizes the slide below summarizes the FY 2023 general operations costs for all sources of funding. If we can go to the next slide, please. And this provides you just an illustration of the funding that we are requesting, and it's broken down by division. And then if we can go to slide 10, the next slide, please. And this is another illustration of our requests by division and all funds. During FY22, the governor declared Guam in a public health emergency during the cases where cases were doubling and the COVID area risk score reaching a higher number of COVID-19. DPHS teamed up with the Guam National Guard and has been out in all of the community to do testing and vaccination to prevent further spread of the disease and to prevent death, hospitalizations, and further risks. We have also been performing contract tracing and have partnered with FEMA and other federal agencies for their assistance. As a result, COVID-19 response and operations will continue in FY 2023. Consequently, our budget request for additional funding is supported as a result of fewer jobs, less disposable income, and the need for medical and dental care from DPHSS services that are free. The funding allocation to meet the COVID-19 emergency response and the cost to operate are included in our budget request for FY 2023. In fiscal year 2022, DPHS received a total of $11.9 million from the American Rescue Plan Act. To date, we have expended and encumbered a total of $9.3 million, with a remaining balance of $2.6 as of April 2022. We intend on using the entire balance by September 30, 2022. Our funding were used as follows. Under personnel, we have 2.1, expenditure is 1.1 with an available balance of 1.0 million. Operations is at 9.8 with an expenditure and encumbrance level of 8.2 or 1.6 available. Further, under the division, in terms of its allocations, Division of General Admin was 2.7 million, primarily for overtime and COVID test kits and our incident command post. Division of Senior Citizens was 5.3 million, and there's a series of grants there that are provided support, such as adult daycare, case management, legal assistance services, elderly nutrition program, to name a few. Under the Division of Children's Wellness, we have 3.9 million for foster care services. In terms of our manpower needs, for FY 2023, it is our assumption that we will continue to work on COVID-19 operations. As a result, the emergency operations, our personnel and other operational costs will continue to increase in order to safeguard the employees as well as the community. However, during this current period, we continue to hire new personnel and purchase personal property and equipment, sanitation and other supplies and equipment. Total personnel breakdown by fund and by divisions for FY 2023 is as follows. And here we have a slide that presents the number of positions that we are requesting for FY 2023. Additional operational needs, if we can go to the next slide. Okay. DPHSS, our newly created established division of Children's Wellness, is in need of providing additional services related to foster care group home due to an increase in the number of children and families in need of these protective services. In addition, the Division of Senior Citizens is also in need of additional costs due to the increase in the cost of meals and transportation and other services. Additional requests for DSC and DCW are $769,877 and $10,326,270 respectively. And here's the presentation on the slide form of the anticipated shortfalls for both the Division of Senior Citizens and Division of Children's Wellness. If we can move on to the next slide, please. And we have a new office. It's called the Grants Management Office, and it's responsible for increasing all grants, maintaining central database for accountabilities and audit purposes. We also have the Community Health Center. These are non-appropriated funds. And the Environmental Health Fund. DH recently proposed and were granted approval to increase their fees in the Environmental Health Fund for sanitary permits and health certificates. A slight increase is not included. The increase is not included in the 23 budget at this time. Federal grants requiring local match for federal grant programs are from two DPHS divisions, DSC and DPW. DSC is requesting for local to match funds for services such as transportation, nutrition, legal assistance, senior center operations, adult daycare, and in-home services and case management services for the aging services. In addition, DPW is requesting for local funds to match the federal programs. DPW provides services to recipients for MIP, Medicaid, and public assistance. The local matching share requirements are for MIP, Medicaid, and public assistance programs, respectively. The local share for Medicaid had a significant change in the federal medical assistance percentage, more commonly referred to as FMAP rate, from 83 to 55, resulting in a negative impact to our current budget and our economic state. This means that more local funds are anticipated to be required in FY 2023 than what was spent in FY 22 due to the drop in the FMAP. Total local match requested amounts to 34.1 from the general fund and 1.9 from the special revenue fund. Oh, if we could move to for the Community Health Center, it was established by Public Law 2428 in the northern and southern regions of Guam under DPHSS Bureau of Primary Care Services. The law also authorized DPHSS to implement and create fees for the health care services. The Community Health Centers have an advisory council and a CHC revolving fund is established. Funds are non-appropriated and the budget is attached for budgetary disclosure. You have the budget? That's it? The budget? The budgetary? Okay. Under the Environmental Health Fund, DPHSS, DEH recently proposed and were granted approval to increase their fees in the Environmental Health Fund for the issuance of sanitary permits and health certificates. The increase in fees will commences in FY 2023 and were not included in our budget report. Thus, additional increase in the Environmental Health Fund by $254,435 for total appropriation of $1,556,500 from this fund is requested. Moreover, we are requesting for your assistance in obtaining legislative approval as part of the Budget Act for 2023 to include additional revenue received to be included as part of our existing appropriation amount. The purpose of this request is so that DPHSS does not need to return back to request for legislative approval to appropriate at a later time. DPHSS budget. Lastly, we would like to present an overview of each DPHSS division's budget request. Your attention on the above budgetary request is greatly appreciated. We have provided the necessary budget requirements to support this budget request. In addition, we provided attachments to further support the overall budget request and additional requests. Senators, on behalf of the hardworking staff of DPHSS, I'm pleased to present our FY23 budget request for your review and approval. Myself, the Director and the Deputy Directors, Mr. Agustin and Ms. Lauren Duenas, and the Controller, Arlene Pierce, as well as all other division administrators, chiefs, will answer any questions you may have for us. Thank you, Senator Sonoxy and members of the legislature, and thank you for your hard work to our hardworking employees at DPHSS. Arthur. Chairman, if we could have the divisions present we've asked them to prepare a couple slides for each division. If we would be able to present that, I believe you have that presentation. We can start with the Division of General Administration, if we can pull that up, and I'll go ahead and do that presentation. So for the Division of General Administration, the Division of General Administration is comprised of the following: Director's Office, Personnel Office, Management Support Services, Performance Improvement Management Office, Health Professional Licensing Office, Financial Management Section, and Grants Management Office. DGA is responsible for providing services to the 5 divisions. These services include providing policy direction, senior management leadership, administrative guidance, fiscal responsibility, quality improvement and performance management initiatives, and personnel-related services. In addition to these offices, the division recently created a Grants Management Office responsible for reviewing grant award packets, applications, notices of awards, and budget to ensure compliance with grant terms and conditions. The GMO works closely with program managers and staff on critical grant matters. Get back to the next slide, please. DGA has 41 positions in its staffing pattern. Of the 41 positions, 11 are vacant, funded, and 30 are currently filled. For FY23, we are requesting for funding to continue to support the 41 positions in this division. Next slide, please. For FY 2023, we are requesting a total amount of $4.3 million, $4,327,733 from 2 funds, General Fund and Special Fund, to cover personnel, operations, and utilities. The proposed FY 2023 budget requested for the Division of General Administration will enable the division to continue its operations in providing leadership direction to all 5 divisions, processing of all HR-related documents, processing of all procurement requests, ensuring compliance with federal grants through Grants Management Office, supporting the 9 HBLO licensing boards, and strengthening our infrastructure through business process improvement initiatives. At this time, I'd like to call on Ms. Zenia Pacino as our Acting Chief Public Health Officer to do the presentation on the Division of Public Health.
Thank you, Director. Good afternoon, Senators. My name is Zena Pacina. I'm the Acting Chief Public Health Officer. So the Division of Public Health is the largest of the divisions. They are governed by 72 mandates and 37 rules and regulations. The mission of the division is to preserve, promote, and improve the health and well-being of populations, communities, and individuals through prevention, education, surveillance, treatment, and regulation. Next slide, please. The Department of Public Health consists of the Chief Public Health Office and is responsible for 6 bureaus: the Bureau of Communicable Disease Control, the Bureau of Nutritional Services, the Bureau of Family Health and Nursing Services, the Bureau of Emerging Infectious Diseases, the Bureau of Primary Care Services, and the Bureau of Alternative Medicine. The division is currently working on the creation of a Bureau of Non-Communicable Diseases that will manage programs such as diabetes, heart disease, breast and cervical cancer, and health disparities. Next slide, please. The Division of Public Health is requesting 80 FTEs for the fiscal year 2023. The FTEs is a combination of classified LTAs, TAs, and unclassified positions. Most of the unclassified positions are like your physicians. Total vacant position is 30 as a result of difficulty recruiting hard-to-fill positions in nursing and other healthcare-related fields. Next slide. Budget request for fiscal year 23 is in the amount of $4,635,613 for both general fund and special fund, of which $718,642 is for operations and $3,916,971 is for personnel. Next slide. The budget justification. DPH will continue to provide the following services based on the requested budget to implement mandates for the bureaus, procure TB medications, maintain personnel levels, referral for dental services and/or treatments, register, certify, and maintain records of vital events that occur on island, provide primary health care to the underserved, indigent, and uninsured populations, provide primary health care to the underserved, indigent, and uninsured population. I said that. Prepare, prevent, respond, and control the spread of diseases of public health concern. Provide community health nursing services. Improve the health and quality of life in our community through nutrition education by eliminating health disparities, early disease detection, promoting healthy lifestyles through policy development, surveillance, prevention, and control of disease and intervention.
Thank you very much, Acting CPHL. At this time, I'd like to call on Mr. Nadeau to do the presentation for the Division of Environmental Health.
Thank you, Bert. Test, 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 test. No, we're not. Is it on? Great, thank you. Half a day, good afternoon. My name is Tom Nadeau. I am the Chief Environmental Public Health Officer with the Division of Environmental Health. Next slide, please. The Division of Environmental Health, or DEH as we're known, we are governed by 24 mandates and its 20 rules and regulations. There are 31 programs and activities of DEH that can be collectively grouped into 7 major functions as noted in the slide. And they are food safety, health and sanitation, animal and vector control, consumer commodities, counter service, radiological health and education and training. As of today, DEH has 32 positions in its staffing pattern, 21 full-time employees, 2 limited-term employees, and 9 vacancies. Currently, the division has 6 competitive active grants for a total of $5.6 million. Of that, nearly half is for the capital improvement project that is still pending. For FY23, we are requesting a total amount of $2,108,609. And those comes from 3 special funds. They are the Healthy Futures Funds, Environmental Health Fund, and the DPHSS Sanitary Inspection Revolving Fund. Next slide, please. The 2 charts on the slide provide visual presentations of the funding source and amounts and how the total amount will be allocated by object class. As the pie chart on the left illustrates, most of the funding will be from the Environmental Health Fund, with $1.3 million, followed by $647,666 from the Healthy Futures Fund, and $158,989 from the Sanitary Inspection Revolving Fund. The Environmental Health Fund derives its revenue from the issuance of sanitary permits and health certificates, while the Sanitary Inspection Revolving Fund gets its revenue from a portion of the registration fee of H-2 migrant workers. Both funds are dedicated solely for the use by the Division of Environmental Health. The pie chart on the right shows that most of the total budget for DEH will be allocated for personnel at around 70%. Next slide, please. The proposed fiscal 2023 budget requested for the Division of Environmental Health will enable the division to continue its operations in inspecting health-regulated establishments, especially eating and drinking facilities, such as we expect to conduct approximately 1,120 total inspections, preventing the introduction of mosquito-borne diseases, such as dengue fever, by increasing our surveillance sites from 20 to 25, processing approximately 39,000 total applications for sanitary permits, health certificates, and the Guam Controlled Substance Registration, responding to all consumer product recalls affecting Guam, and all import detentions at ports of entry, which are expected to be in the numbers of 10 and 70 respectively, providing sanitation training to nearly 36,000 health certificate applicants employed at food facilities, cosmetology establishments, and hotels throughout Guam, and promoting education and awareness to empower the community in making informed decisions, such as where to drink and dine, what consumer goods to avoid, and how to protect themselves and others from mosquito bites, unsanitary conditions, and other environmental health hazards through the use of social media, press releases, and outreaches. Thank you very much.
Thank you very much, Chief Nadal. If we could please ask Senior Citizen Administrator Charlene Seneclas to present the slides for the Division of Senior Citizens. Thank you.
Buenas and Hafide. My name is Charlene Seneclas. I am the Senior Citizens Administrator for the Division of Senior Citizens of the Department of Public Health and Social Services. Next slide, please. The Division of Senior Citizens, in accordance with Public Law 14-139, plans, coordinates, and implements programs for senior citizens through a formal support system to address their needs and challenges. There are over 13 programs and activities DSC provides through the State Office on Aging. The division has 3 bureaus. The Bureau of Community Support provides information, referral, and assistance services to seniors, their caregivers, and family members. The Bureau of Adult Protective Services receives and investigates all reports of abuse against the elderly 60 years of age and older, or adults with disability 18 to 59 years of age. The Bureau of Program Administration and Development is responsible for ensuring home and community-based services, which are a critical part of Guam's long-term services and supports. The current and proposed staffing for the Division of Senior Citizens. As of today, the DSC's FY22 current staffing include 19 positions in its staffing pattern. Of this, there are 11 full-time employees and 8 funded vacancies. The division anticipates the FY23 funding to operate at the FY22 staffing levels, to be maintained at 19 full-time equivalent positions. Next slide, please. DSC's 2023 budget request for FY23, DSC is requesting $14,930,295 from 3 funds: the General Fund, Healthy Futures Fund, and federal funds. Further, the 2 pie charts provide the funding source and amounts requested. The pie chart on the left illustrates the funding from the General Fund of $10,902,624,000, or 73%. Federal funds of $3,425,994, or 23%, and special fund, Healthy Futures funds, of $601,677, or 4%. Next, I'm sorry, stick to that slide, we can go back. The pie chart on the right illustrates the allocation by object category. $13,384,332, or 90%, for contractual is followed by $1,313,331 for personnel, and $232,632, or 1%, for operations. Next slide. The proposed fiscal year 2023 budget requested for the Division of Senior Citizens will enable the division to administer One, home and community-based programs to provide over 400,000 homebound meals annually, Monday to Sunday, excluding recognized holidays for frail senior citizens. Provide door-to-door transportation services for seniors from home to senior centers and adult daycare centers. 3, provide legal assistance services for senior citizens through the Elder Justice Center. 2, protection and advocacy. Receive and investigate referrals of abuse and neglect. Provide a 24-hour protective services shelter for victims of elder abuse, ensuring a safe environment and preventing further abuse, including access to a 24-hour, 7-day-a-week hotline for the community to report abuse. Third, information referral and assistance for seniors and their caregivers to make informed decisions on services such as navigating Medicare health insurance.
Thank you very much, Administrator St. Nicholas. If we could call on Task Archangel, who is the Chief Administrator for the Division of Public Welfare, to present the DPW slides. Thank you.
Good afternoon, Senators. My name is Maria Teresa Archangel. I'm the Chief for the Division of Public Welfare. The Division of First slide, please. The Division of Public Welfare is responsible for providing a vast array of welfare services to the low-income members of our community to improve and maintain their quality of life. The division administers the following program: Supplemental Nutrition Assistance Program, or other known as food stamp, cash assistance programs, which includes temporary assistance to needy families, aid to the blind, aid to permanently disabled, and old age assistance. Also, we administer Medicaid program, which includes the Children's Health Insurance Program, the regular Medicaid, Medicaid for childless adults, and the Enhanced Allotment Plan program. And also, we administer the Medically Indigent program. Next slide, please. In fiscal year 2021, the division processed 44,102 applications for renewal, reopen, and new applications, and 23,307 change reports. This represents a total of 67,409 documents reviewed and processed by eligibility personnel. The second table represents numbers from fiscal year 2021 and fiscal year 2020 that illustrate a typical number of individuals and households or cases enrolled in our various programs. For example, well over 50,000 individuals representing 18,000 to 19,000 households are enrolled in SNAP. Next slide, please. For the current fiscal year, the division has 86 classified filled positions and is in the process of recruiting 39 funded positions. For fiscal year 2023, we are requesting a total number of 129 positions for the division. This is an increase of 4 positions from fiscal year 2022, total of 125. Despite the shortage of staff and other resources, the division continued to carry on its mission and functions to meet the program mandate and assisted the COVID-19 team on its mission to combat the spread of coronavirus. In fact, as of late May 2022, DPW personnel have done their best to provide services to more than 50,000 unduplicated clients, processed more than 326,851 claims from providers, issued more than 93 million SNAP and 2.3 million cash assistance program benefits, as well as 99.6 million and 3.6 million worth of claims for Medicaid and MIP respectively, with an overall total expenditure of 198.5 million. Next slide, please. Okay. In fiscal year 2021, the total cost of DPW programs is $334.4 million. Of that amount, $321.6 million was in direct program benefits to clients, and $12.9 million was for administrative and personnel costs. Of the $12.9 million, $8.3 million is for personnel cost and $4.6 million is for operation. Next slide, please. Okay. As mentioned earlier in slide number 5, $321.6 million in benefits were issued in fiscal year 2021. The bulk of this amount is $169 million for SNAP and $123 million for Medicaid benefits. The remaining $28.6 million includes MIP, Cash Assistance Program, CCDF, and foster care. Next slide, please. Okay. We are requesting $41.1 million for DPW's fiscal year 2023 operation, largely for matching federal funds as well as maintenance of effort. Of this amount, $39.1 million will be from the general fund and $1.9 million will be from the Healthy Futures Fund. With available resources, our Division of Public Welfare will continue to administer, next slide please, to administer the eligibility determination process for public welfare programs which affects close to 20,000 households on Guam, conduct accountability and quality control of DPW programs, administer the coordination of benefits, provider enrollment, claims management, and accountability for Medicaid and MIP for its roughly 55 enrollees combined, and close to $180 million in healthcare service claims, and promote positive social conditions that contribute toward the attainment of the highest social well-being of the economically and socially disadvantaged population. Thank you.
Thank you very much, Chief Archangel. If we could please proceed on with the Division of Children's Wellness, and we call upon the Acting Chief Human Service Administrator, Patricia Magnus. Thank you.
Good afternoon, Senators. I'm Patricia Magnus, the Acting Chief Administrator for the new Division of Children's Wellness. The Division of Children's Wellness, or DCW, was established on January 1st, 2022 via Executive Order 2021-026 to respond to the needs of Guam's children and to streamline services in addressing the care and well-being of our island's children. The Division of Children's Wellness oversees the Bureau of Social Services Administration, the Bureau of Child Care Services, and the Preschool Development Grant. The Bureau of Social Services Administration includes Child Protective Services and the Foster Care Licensing Office, which responds to and investigates child abuse and neglect referrals, provides foster care emergency housing for children, recruits and licenses foster care families and homes, identifies services and immediate needs for affected children and their families. As of today, DCW has 138 positions in its staffing pattern, 79 full-time employees, and 59 vacancies. Next slide, please. For 2023, we are requesting a total of $6,391,606 from the general fund. The chart on this slide provides a visual presentation of how the total amounts will be allocated by object class. 44% under miscellaneous covers foster care payments, annual clothing allowance, court order payments, and petty cash. 40% under contractual will cover the cost to continue services for children and women at the Ali 1 and 2 shelter, Guma San Jose shelter, building insurance for the 3 shelters, and for the maintenance costs of the PH Pro case management system for BOSA. 15% will cover personnel costs for the 13 staff under CPS, Child Protective Services. 0.009% will cover travel, lodging, and transportation costs for personnel and foster care children needing medical care and relative placement off-island. 0.001% will cover fuel expenditures for approximately 10 government vehicles utilized for transportation to visitations, recreation, court hearings, school, medical, and dental appointments. Next slide, please. This slide shows FY21 and 22, which is inclusive of October 2021 and May 2022, and projected FY23 numbers. Referrals are complaints or concerns made via email, fax, phone, or walk-ins. In FY22, there have been 1,070 referrals received. We project that in FY 2023, a total of 1,605 referrals can be expected to be received. The next one is children subject to referrals, refers to the number of children involved or identified in a complaint or concern. In FY22, there are 1,391 children identified as a result of mandated reports or referrals. We project that 2,087 children will be identified or subject to referrals in FY23. Foster care maintenance payments covers the cost of food, clothing, shelter, school supplies, and child personal incidentals such as toiletries or undergarments, etc. Foster parents receive monthly financial assistance to care for foster children as follows. Children aged 0 to 11 receive $577 per month, and children aged 12 to 17 receive $779 per month. As of April 30, 2022, we have 566 children in foster care. We anticipate a 25% increase for FY23, averaging 700 children, which is an estimated cost of $2,785,483. Annual court payments are reimbursement payments to foster families who cover the costs for medical, dental, medications, uniforms, passports, and identification documents for our foster children. We anticipate reimbursements for 700 children in FY23 with an estimated cost of $32,243.86. Petty cash is used to cover the cost of over-the-counter medications, food, and other immediate needs for children under foster care. Due to the increase in the number of children, we are requesting to maintain petty cash of $1,000 per year. The total request for miscellaneous expenditures equals $2,816,107. Next slide, please. The proposed FY23 budget request for the Division of Children's Wellness will enable the division to continue to protect our children and work proactively to reunify our families, provide services to abused and neglected children and their families, address and identify services that will ensure a safe and conducive environment for the children in our care and custody, provide interventions and outreach in the promotion of the safety and well-being of our most vulnerable and at-risk children and families, identify loving and caring homes as interim placements to permanency, recruit, incentivize, and retain quality staff to effectively implement programmatic and mandated processes, cover travel, lodging, and transportation costs for personnel and foster children needing medical care or relative placement off-island, provide emergency shelter for children and women at Ali Shelters 1 and 2 and Gumat Minaasi, as well as shelter for homeless families at Gumat San Jose. Assist, support, and increase our network of families to care for the increasing number of children in need of foster care. Continue our partnership with the Mayor's Council of Guam on its It Takes a Village campaign, which has effectively recruited 16 new foster families as of May 2022, and to provide Governor of Guam group health insurance for all children in our care as part of Public Law 32189. Thank you.
Thank you very much, Acting Administrators Moffett. At this time, Chairman, this is our presentation for the FY 2023 budget for the Department of Public Health and Social Services. Thank you, committee, as well.
Thank you, Mr. Snoxy. I have a few questions, but main question I'm concerned about is that you identify quite a few vacancies. What is your vacancies? What's the total cost for the vacancies to be filled? If it was funded, vacancies, not filled. You got a warm body, funding's there. You don't have a warm body, what does it cost?
Just so I'm clear, you're asking for the cost of funded vacancies?
To fund all the vacancies.
Oh, to fund all the vacancies.
Yeah. Because when I look at all your projection here, then my next question is going to be, how long has those positions been vacant? Because I did hear from your staff, they're hard to fill. So how long ago was it hard to fill? Was it a year ago, 2, 3, or before the pandemic? And what I'm trying to get at, Art, is that number one, if you can't fill it, then I would only say that maybe we need to figure out a way how you can fill it and identify the source of funding so that the positions you can fill, you make sure that's funded. I mean, if you know you can't fill a position and you've been at it for, I would hope not 5 years, then you're almost, you've been climbing up that hill forever. You're never going to get there. So what are the positions you need to keep going? Because every time you come in for a budget, you're always going to be asking for money, for funds. And if you can only get so much, then you want to be able to identify what are the positions that you realistically believe that you can fill, and then go for it. Because I'm not saying I don't support to fill your vacancies, okay? I'm just saying we're trying to be very realistic. When I looked at one of them here, I think identified 30 position vacancy. How long ago has that 30 position been vacant? Those positions have been vacant. If it's been vacant for 3 or 4 years, do you anticipate on ever filling it? I love what you guys do. I support what you guys do. But realistically, you can't inspect an establishment because you don't have people, because you can't hire them. Let's move on. Let's figure out how to keep the funding so that when you do have an applicant, you can fill it. But let's not just have a bunch of funds sitting and just sit for a year. They could have gone somewhere else. That's what. And when you do have the information, provide me a copy so I can provide to you oversight so we can take a look at it and we can see how we can help you.
Okay.
We're not here to strip you of funds, okay, or what your request. But we want to give you the biggest bang for your dollar.
Thank you. We will provide you a listing of our funded vacancies. Okay. And also, I do know that many of them are tracking, and some of them are already in the process of being given us a list of eligible applicants. So it really varies by division, but we'll give you that list, Chairman, and we'll provide you.
If you have the people ready, the application went out, they're waiting for interviews, then as far as I'm concerned, you anticipate to hire them. So we just got to make sure we identify that as a warm body. It's inbound. By the time we finish the budget, they might be already sitting there. And we want to make sure the funding's there. Not oops, I forgot. It ain't going to work that way. We got to be able to anticipate that. Okay? Other than that, Oversight Chair, if you have any questions to the panel, they're yours.
Thank you all for your presentation today and for all your work during the year, of course. Let's just start with the vacancies. So the vacancies that you presented are actually funded vacancies.
Yes, ma'am.
So they're in different stages of recruitment.
That is correct, ma'am.
All right. In particular for the Division of Children's Wellness, that one like 59 vacancy, or just 39? Hold on. It says 59 vacancies authorized, already funded, just vacant, unable to fill yet. And then under your budget justifications list, you said you're going to recruit, incentivize, and retain quality staff to effectively implement programmatic and mandated processes. So I'm wondering, how are you going to do that? What are you going to do different to fill these vacancies? Particularly, I'm thinking social workers, there must be, right? So what do you expect?
With regards to the Division on Children's Wellness, if I may start, and then of course Deputy Terry or perhaps even the Acting Administrator, Tricia Moffness, can add on. So for the Bureau of the Division of Children's Wellness, specific to the Bureau of Social Services Administration, we have the provision of ensuring that we pay our employees night differential, overtime, and incentive pay. This allows us, we hope, to retain and recruit social workers and homemakers and other staff exposed to the risk of Child Protective Services activities in the delivery of those services to stay with the Division of Children's One, specifically in BASA. And we're hoping that that would also entice other practicing social workers to consider a career at DCW specific to BASA.
Okay, sorry, did you say night differential and overtime? Was there one other one?
There's incentive pay. We are
Incentive.
authorized to provide incentive pay to the social workers and the homemakers and some other staff within the division, within this very specific bureau, who respond and assist and support children in response to child abuse.
Okay, is that new, or you've already
We
always?
actually became, the incentive became, I believe, Executive Order 2021-026 is what I believe provided that
In
incentive.
2006?
Executive Order 2021-26.
2021,
Right.
okay.
And so I believe that was effective, was it January 1st? With the creation of the new division on January 1st, 2022, that's when those incentives became available.
Okay. Okay, great.
Thank you.
So I hope they are successful, or you are successful, and congratulations on the new division. And then about the shelters, just wanted to know, with this money that for FY23, you listed the shelters that are already in operation. You also listed Guma Minaasi. Are you planning to open any new shelters for children or families?
Thank you, Senator. You know, with the large number of children that actually through referrals are being addressed and vetted, we are finding more and more children that are having to be removed. And granted, BASA's priority is not to remove them as much as it is to make sure that they are out of harm's way. If within a family, if one of the two parents, if one is the alleged perpetrator and the other one is a supportive parent, the goal is to leave the children in the household to lessen the number of children who are in the system, but at the same time to lessen the amount of trauma that the children are exposed to. But in those cases in which it is not a supportive home and we do have to make removal, then of course right now we are using the Guma Minaasi shelter, and we do have Ali Shelter 2 as well. We are considering the potential for a third shelter, sort of as a emergency receiving home. However, that is just in the planning, except for consideration. It has not had much movement.
Okay, so that's an emergency receiving home for children. And what about the homeless shelters for example, Guma San Jose? It says homeless families. So I think the point in count showed a lessening of homeless families, but I think most of the people in Guam think we are noticing an increase in homeless families, particularly children. And so I just wondered, are we able to handle all of them in the existing shelters, or are we in need of additional shelters?
Okay.
Your homeless program, how's it doing? Are we accommodating? Is there a wait list? You can speak, but she's asking, are we accommodating the need in the community?
Hi, Senator. So our Alley 1 shelter does assist with housing like families with children. So yes, we are accommodating them there, and as well as Guma San Jose. But Guma San Jose does also, it's inclusive of others, such as single males or females there, right? So the families go to Alley 1. Right now, there has been no discussion of if we need more for the families. So that's something we can definitely look into, our numbers and the need, if there is there too.
Well, the last time I checked into this was prior to the pandemic, and we were maxed out at every shelter. So there was a great need back then, which was only 2 years ago. So I'm curious why that discussion's not taking place.
Madam Speaker, what we could do is check our data from our programs and find out if we have a wait list. If there is a wait list, or we're having a situation in which we cannot admit eligible members into the program, we will provide that information to you.
Okay, thank
All right,
you.
thank you.
All right, and then about the Government of Guam group health insurance for all children in our care, especially foster children, isn't that something funded separately by the legislature, or are you saying that you use your funds for that?
That is locally funded.
It's locally, but is it funded with your budget?
I'm sorry, Madam Speaker, I was trying to get the mic back on. Yes, it's a line item budget into the Department of Public Health and Social
Okay,
Services
okay.
annual budget.
All right. And that has been enough, right, Tess? Or whoever's in charge? Is that enough? Has it been enough in the past?
No, it's identified in our shortfall that we do need more funding because of the increase of foster care children and our anticipation of an increase for FY23. So it's each child is covered under the Gov Guam insurance premium. So also depending for the next fiscal year, a new vendor, a new cost, we would have to evaluate again. But we are short, yes.
So I think they're pretty much covered, like they will get the insurance, but it's our paying of it is that we're going to have to find a way. We always have to find a way because it's mandated by law already.
Correct.
Yes, Madam Speaker, and you know, with the partnership we have with the Mayor's Council, in which I believe 16 villages were able to find additional homes, and the continued effort of that partnership as presented in their division-specific budget, is that we anticipate more foster homes opening up, and unfortunately that also means, you know, that we're responding to more cases, and that's a current situation, but in responding to those cases, we have more foster homes and children be placed in those foster home settings, translating also to a need to provide the foster care health insurance program to extend to the foster child or children.
Yeah. So you're estimating an additional about 140 more children next year in foster care. Okay, what about just the, I can't remember which division this is, but public health. It says referral for dental services and treatments. Referral, does that mean the actual services, or you're referring them elsewhere? The dental services? Because my understanding is that the dental services has not been provided during COVID, this entire 2-year period.
Hi, Senator. You're correct. It is referrals for services and treatments. And if you remember our central public health, where our our dental services used to be located, we no longer have the central public health. And so our services actually moved to the northern public health. However, it was referral services, minimal services until our dentist retired. So as of now, it is referral for to the outside clinics and so forth.
Oh, so now if they need dental services, you are going to cover the cost at an outside clinic until you recruit another dentist?
Correct.
Okay. And then what about, so the other list under public health budget justifications includes provide primary health care to underserved, indigent, and uninsured populations. Is this separate and apart from the community health clinics, which are supposed to be funded on their own with fees?
It is separate. So we do have services where we serve the underserved population, and that's with our nursing services, which we do have, where we do need funding. That's Project Pesita. We have the nursing services that do go and provide homebound services, and so forth.
Okay, so those are not through the community clinics. These
Not
are
through
Public Health Central.
Correct.
Okay. And then, all right.
Yes. And Senator, they can go to the health centers as well.
Okay.
So they can go to the health centers, but we do have services that are provided by our nurses in the central that do go and provide homebound.
Because we don't budget that, right? The ones out in the health. I'm just wondering why don't we let everyone go to the clinics?
Well, that's primarily, Speaker, that's because we have these different types of programs. For example, we have programs that are target for special target populations, So like Xenia is acting CPHL is sharing that we have a team that goes out to assist those who perhaps that are homebound. But then the community health center is open to our general community. So that is always, and I'm just sharing with the acting CPHO that yes, we got some programs that are very target specific, group specific, addressing a health condition or a high risk condition. But also the community health center is another area in which individuals on our island can seek services. Thank you.
Okay, thank you. So it looks to me like one of the largest increases that's being requested is for the Division of Senior Citizens. Is that correct? And maybe you could just explain the difference? I mean, why such a large difference versus last year? Is it increased services or just?
Yes, so in FY21, we did get our funding that we normally would receive through the general fund. We did not receive. We were at a rate. We were fortunate though, because we did receive American Rescue Plan to help us with our supportive services, our nutrition services. So that's helped us in FY21, which carried over to a portion of FY22. So in FY23, and even if you look at prior funding levels for the Division of Senior Citizens, there has always been a great amount provided on the supportive services side. Supportive services, Speaker, includes our adult daycare, our case management, our in-home,
Yes.
our
Are
legal.
so the question is, are we increasing services or we're just moving the costs around? So same services?
We are anticipating to increase services. As everyone may be aware, our senior centers are back, our adult daycare centers are back. So we anticipate additional services in terms of our transportation, our adult daycare, our case management.
Additional to what we used to do?
Yes, we have more seniors that are in need, right, of aging services. So yes, I believe,
So
yes.
we have an increased senior population.
Yes.
That's why we're increasing services, and that's why we're increasing. And I know, yeah, the Division Senior Citizens, I think we gave the budget that was requested last year. Okay, so, but you're expecting additional seniors?
Yes.
Okay, all right. And then, Tess, if you could explain, I thought that the federal match that under the Division of Public Welfare that's being requested this year is less than what was received last year. Is that correct? And it's less than what the...
That's the proposed based on the ceiling, Senator.
Sorry,
yes.
can you repeat that?
Yes, Senator. That's the proposed based on the ceiling.
Based on the what?
The ceiling, budget ceiling.
Ceiling. All right, this is less than what the governor allocated in her budget for public welfare. It's also less than last year. So is this less than what we need?
It depends, Senator. Because the FMAP currently, it will revert back to 55% come December 14. So if it stays at 83%, I think based on the estimated or based on the projection of what we're going to incur as expenditures for Medicaid, that would be enough if the FMAP stays the same.
But you just said you expect it to stay the same until 2014. Is that right?
That's what CMS told us.
Oh, okay. CMS is telling you, but that's not in statute or any bill yet. Okay. Yes. Director?
I just wanted to follow through with that, and that's absolutely correct. Yeah, right now we're at 8317, and that's, as Chief Archangel shared, that 8317 FMAP is good through December 13, and on December 14, there is a possibility that the FMAP will revert back to 5545. However, there is a concerted effort for us to continue to advocate that we achieve parity, and one of the 2 points of parity is that we maintain the FMAP at 8317. So we're continuing. Tess and I have been to some of the insular subcommittees. We've, I think a few of the, maybe one or two of the senators have actually written to support the Medicaid parity effort. And so we're continuing that conversation in the coming months. And we hope that prior to December, that we will maintain the FMAP of 8317, the match required.
What do you mean prior to December?
Because our FMAP is good till December 13 of 8317. That's what Tess is sharing. And on December 14, it's 5545 if it doesn't stay at 83 from December 14 on.
All right, but I thought you have an assurance from CMS that it would extend until 2014.
That's what I wanted to clarify. The 2014 is December 14.
December 14th, sorry.
Yeah, I just wanted to be sure,
What?
Speaker.
So is this enough to cover if the FMAP does not change? I mean, if it changes as expected on December 14?
If it
So you're
stays
saying
at
CMS is telling you they're going to reduce that?
Yes.
Reduce
They
their
will-
coverage?
Well, based on the email that we received, it will go back to 55% based on CMS.
Okay,
But
that's
of course, we don't have any more, we don't have any knowledge of what Congress is going to do.
But let's
Beyond
say
that.
we act on what they've given you in an email, in writing, then
All
is this
right.
enough?
Then that's not enough. We're going to have a shortfall.
That's what it sounds like. All right. And so you don't want to request funds for that? You want to just deal with the shortfall yourself, Director?
It's really, it's one of those things that we're going to have to project out because we can do 8317 through December 13. And then from December 14, I think Tess has a computation with us this afternoon of what that would look like from December 14 on at 5545. And if Tess, you have that numbers, you can share with
Yes.
the Speaker and the committee this afternoon. Thank
All
you.
right. So yes, well,
Based on the projected expenditure, we will need roughly 19 million more if we revert to 55%. But if there will be carryover of fiscal year 2022 lapse funding, it will go down to 7 million shortfall.
okay, so you might need $19 million more. You've got, how many, how much in lapse funds? 12 million?
Rough potential, yes.
Okay, 12 million in lapses that you could use, or you might need 19
We
million
might
in
need
an
it.
appropriation.
Yeah,
Okay.
depending.
All right, what about the MIP test? The MIP, the request again is maybe?
Because the budget was submitted ahead of time, so that request for MIP, that funding will be used to match the COFA that was transferred to the Medicaid program.
Medicaid?
Yeah,
So you
because-
don't find a need anymore for this much MIP money as you had last year?
Yes. no.
It's reduced,
It's
I just want to
reduced.
confirm that. So that is confirmed reduced MIP costs.
Yes,
So we've covered most of those that used to be on the MIP under the Medicaid now, under the COFA, and now those people, there's still people who only qualify for MIP, but
Yes.
you're only estimating 8.3 million, as opposed to 14 million last year.
yes. It can be lower than that because
Lower
we're
than that.
transferring most of the COFA because most of clients under the MIP program are COFA. Majority of them are COFA.
Okay, great.
Citizens.
Okay, well, that's good news. And we are getting them enrolled?
Yes, yes,
Okay.
sir.
And then, and then, before I move to Division of Environmental, one more thing. So that the shelter, the children's shelter, is it operating now? The Regalu, what's the name of
The shelter Gumamaasi?
it? Okay.
You know, actually, it's been operating for some time. We did work through GSA to put it out for bid, and that still continues to be a procurement process. We do know that the documents right now are with the AG's office, which is good for review and approval. However, in the meantime, because of the need to stand up the shelter, we stood it up. We staff it temporarily with our limited term appointment staff, as well as some of our BOSSA staff. But it's been operating now for several months.
Okay, great. How many children are in there?
Its capacity is at 23. We have, I think, 19 children, around 19 children that are there, so it's well used.
Okay, great. Thank you for standing that up. Thank you. Okay, so then Division of Environmental Health, you're requesting, well, the request that we received was 7% less than what you received last year or authorized last year. And so you're proposing to cover that through the balance of the revolving fund, or I think it's a revolving fund, or to be allowed to use an additional amount that might come in due to the increase in sanitary fees.
That is correct, Speaker. We are projecting an increase in the revenue for the Environmental Health Fund because of the fee increase, which we'll be implementing in fiscal year 2023.
In November.
November this
So
year.
the beginning of fiscal year 2023?
That's correct.
Okay, great. Okay. All right. All right. And then if you could just talk to me about the HPLO revolving fund. So this is the professional licensing boards, the revolving fund. The amount that's being appropriated, is that the amount that is available? Or the amount that's being requested, is that the amount that is anticipated to be available in that fund, collected by all the boards?
Yes, Senator.
Okay, and it will be divvied up between all the boards
Yes.
as usual? What they bring in, they are able to spend, and they contribute to the central HPLO operations as well?
Yes. We created object classes for each of the individual boards.
Okay, great. I don't want to hear anymore that they can't do something because they didn't have the money, right? That's not going to happen?
That was at the beginning of.
Make sure. And then, so the senior citizens, the increase does not, is there any increase in contractual? I mean, they said meals or something.
Yes, correct. So we are requesting for supplemental increase. So for the meals program, for both the congregate meals that's provided to our seniors at the 12 senior citizen centers, the 3 adult daycare centers, and also for home delivered meals. So our division was requested to by our vendor, current vendor, who had requested a meal price increase. So they submitted their supporting documents. It took a while for us to coordinate. We worked with the Bureau of Stats and Plans. We looked at the Guam's Consumer Price Index. We worked with Department of Labor's chief economist to review the documents that were submitted, the supporting documents for the meal rate increase. At the end of it, the vendor's request was justified. The government, based on the review, not just internally from us, but also from the Consumer Price Index for Guam, and the chief economist that looked at transportation, they look at meal rates. So there is an increase of 0.90 cents for meals for both congregate and home delivered meals. So we are requesting supplemental funding to cover that. Back when we had prepared our budget request, we had put forth for congregate meals $5.49, budgeted at 780 clients. The meal cost rate increase of the 90 cents, there was also a meal rate increase due to COVID-19 back in 2020 for 4 congregate meals. So we went from 549 to 674, and this is about April of 2020. A request that came in that we received back in December was for $7.64. Okay. So we, of course, reviewed the request of 90 cents. So the additional cost to provide 69 service days for clients under congregate meals to receive 53,820 congregate meals. We're projecting to cost $413,290.80.
Okay, the increased contractual services for Division of Senior Citizens is 8.9 million. Is that mostly meals?
We're looking at the budget digest for 230. Is that what you're referring to, Speaker?
I don't know what you mean by 230. All right, well, we can talk about that later. If I could ask just a couple more questions. So the Guam Cancer Registry, there was an appropriation last year of $389,000, and it said any unexpended funds will revert to the Guam Cancer Trust Fund. Do you anticipate lapses in the Guam Cancer Registry? That's one of those miscellaneous appropriations to public health. Are there lapses? Yes.
Yes, hello? Hi, Arlene Pierce, Controller. I believe that the appropriation for Cancer Registry is a separate line item.
Yes. But do you control it? Is there a balance? Is there going to be lapses in that appropriation?
That would be under DPH.
All right, if someone can answer that later, perhaps. And then, what about this SNAP penalty request of 400,000? What is that? 400,000 penalty?
That's in the event of error rate. As you know, the error rate is also being calculated or determined by our QC people. Bureau of Management Support does the QC of all SNAP applications. And the highest rate error, or the highest error rate is on the client's fault. So, depending on the QC findings, we may or we may not have penalty, but we always put that penalty amount in there, in the event.
In the event?
Yes, and at the same time, we utilize that also, if not, if there's no penalty, to hire more eligibility specialists.
Okay, great. Is there any penalty this year?
For 2021, no.
22?
I'm not sure of that yet.
Okay. And then the, Director, do you remember in the Public Law 3654, there was an appropriation of $5 million from the savings from one of the bond refinancing. That $5 million was supposed to go towards temporary assistance in the form of grants distributed to local nonprofits for food and commodities for homeless individuals, unemployed individuals, children, low-income families, until fully expended. Could you just tell us the status of that?
Sure. When we got word of that, through the discussions we've actually had, Speaker, Task Archangel and her division are identified to stand that program up. Arlene, our controller, has been tracking that. And Arlene, as of this morning, we still don't have any funds in that account. Is that correct? Yeah. As of this time, Madam Speaker, their account right now has no amounts in it, so we're not able to move forward with that effort.
But you're ready?
Well,
and they just haven't put the money in the account,
I wouldn't say that we're ready. What we need to know first is how much of that money is.
$5 million?
Right, but we don't have it, not even like 100,000,
Well, you can plan. It's supposed to be $5 million,
Right,
and if it's not been deposited, it's already almost the end of the fiscal year.
yeah.
I think that should be brought to somebody's attention.
Yes, actually, that was something the controller and I were talking about, to meet with the other agencies and discuss this further.
This is for food.
Yes.
And this is something that I think people are very much struggling with right now. Every day you hear about the costs of living going up, the gas prices, the food prices. And I feel like a more urgent response from public health would be appropriate.
Yeah. Yes, we will follow up with the meeting. The controller and I were talking about that just earlier this week, about the status of that. and we'll check on the account. But we did check earlier this morning on the status of it again, and Controller has actually been in communications with DOA on this, and we're going to need to follow through on that as well, Madam Speaker.
All right. The other day, I was at a veterans event, and the governor announced that you will be moving out of the building that you are currently in, and that the veterans are going to be able to take over that building. Could you please explain that?
Sure. The idea here, and I'm working with our general admin team, is that if you access services with Public Health and Social Services today, you need to go to several locations. Immunization, for example, is up in the Manila building. We also have the Division of Senior Citizens there and Healthcare Financing. So we've got some offices there. If you're looking for services for HBLO or even children's services, you would have to go down to the Turlahi building. If you're going to need to look for services for environmental health, like sanitary permit health certificate application processing, you would come down to the Hessler office. So in addition to our North and Southern Health Centers and Wiccan and Tizen, we're really spread throughout the community. And so what we wanted to do was make it so that it's efficient and ease of access, so that perhaps we can even be in the route for the Guam Regional Transit route, or maybe we can request to be included on that route. So the department is moving towards a combined office rental so that all these offices would operate from a general location, whether it be a single building with multiple floors or multiple buildings next to each other. So if you wanted to come to Vital Stats, today Vital Stats is in Rancare in Tamuning. But if you wanted to come and get your vital for birth certificate, in the future, the plan is that when you come to Public Health and Social Services, you can apply for assistance. You can also seek your vital records. So it's moving us together so that we be more convenient for the customer and for our sharing of resources as well.
Sure. And is that going to come at a less cost or a higher cost?
You know, we don't know yet because that's in the process of the bid. But I will share with you that in a recent review by preliminary work done by the Public Auditor, Office of Public Accountability, we have different offices on lease status with the same landlord, and we don't have the same rate. One division is paying more for less office space, is paying less for more office space, while another division is paying more for less office space. So one, like Tess is paying more for one of our offices, while Senior Citizens is paying less.
I'm sure because of the fire that you bid these all out at different times as well, right?
So we need
and some were out earlier, some were later, and then they moved around. You guys were at another building, and now you moved to Hessler.
Right.
So I just want to know, you know, to say we need to consolidate, is that really imperative at this point? You know, if we're saying we're still in an emergency situation and now we're going to prioritize moving again, I like the idea if it's going to save you money, but if it's just some, I don't know. So the promise that I heard was that that building was going to be available to the veterans in 6 months.
Yeah.
And so you're saying you've already procured this new space?
We have a bid in motion.
Consolidated space?
Well, we have a bid in motion, and we have a bid in motion for the lease of office space. It'll have to go through a bid.
A bid in motion?
Yes. So the procurement is already in motion. The process to procure is moving forward, and our plans to do this, we've actually been talking about this for some time, just in line also with us thinking about the medical complex and trying to find a way to make it more cost-effective, but also efficient for the customers and for the staff.
Right.
So that we can
I thought we were
share
going to do that when we built that complex. I didn't know we were going to
Right, but
prioritize that now. So, yeah, it just seems like public health has been through so much. They've been through a fire. They had to move, then they had to move again, and then
Well, part
again,
of this, yeah.
and then,
Well,
so I just
Well, part of
wonder-
this also, Speaker, is to actually find the right floor space. We got some folks in the health center that were part of the central facility that we still need to
Yes.
find adequate office space for. So this would also address that
And so
now.
I understand too that public health does not have any more interest in their central facility and that they're willing to give that over to some other entity.
Right.
I don't understand that because we have gone through great efforts to have community health centers, southern, northern, there's none in the central right now.
Right.
We closed the dental, we closed several things. I don't know, it just seems like until we build the new hospital complex and put everything central, that in the interim, if these places are usable, that I would think we would use them. All right, thank you, Mr. Chair, thank you so much.
All right, thank you. Senator Tello, do you have any questions, ma'am?
Thank you, Mr. Chair, and good afternoon to my colleagues and especially to Public Health. Thank you so much. You know, you're probably the only agency where I'm taking up a lot of space in paperwork because it's quite large, your department, and most especially it's definitely something that's very important, one of our most important agencies in the community. A lot of people rely on your services. I am too surprised about not being able to go back to the Manila facility to save some money for the agency. In fact, there's a bill out trying to use that for GCC. It doesn't make any sense. I wrote a letter to Department of Public Works and asked them if it's been condemned because there's been articles in the paper saying that somebody from Public Health said it's been condemned. But when I called up DPW, it's never been condemned. There was no fire department coming in there condemning it at all. So I'm not sure why you're not going into that area too. I share the same sentiments as the speaker. So, you know, it's not a done deal. You said you're out for bid right now. Is that correct, Director? You're out for bid.
Yeah, we are in the procurement process for that.
Have you had any people providing any kind of interest?
I can't really speak to that at this time.
Because it is a bid?
It's a bid, but also I would need to check with the lead on that as to where we're at. So,
does Public Health still own the facility in Manila?
I would imagine until you mentioned a bill that becomes law, perhaps that would ban the official transfer. I'm not familiar.
No,
with
I'm asking you, does Public Health own the facility right now, the one in Manila?
Until I understand, Senator, that would be our building for now until
that
it's
is your
transferred.
building still? You still
Until
own the
transferred.
building? Right? I'm sorry, the muffling is so bad and my hearing is not very
Yeah,
good.
that is what I understand until it is officially transferred.
Well, unless you want to keep the building, you know, it's not like you have to officially transfer it. I know the building is not obsolete for you. I mean, it was a bomb shelter in the first place, so it was not the ideal location for an office. But right now, you know, the funds are quite, well, for some people it doesn't seem scarce, but it would be if we don't continue to have federal funds to be provided to us and the ability for Medicaid, Medicare to be still at that 83-17, right? 83-17. I recently read an article in the NCSL, which is the National State Legislatures, you know, and they did some research on this, and it said that Biden, by next week, Monday, is going to determine whether he's going to continue with the state of emergency with COVID, and whether he's going to extend it or not. And this is going to be on Monday. If he does, it's only going to go as far as October. That's what it was said. So it's I'm confused with your statement about that this is going to continue on until 2024.
Oh, I'm
Yeah.
sorry. Sorry, Senator.
Go ahead, Tess. Thank
Just
you.
want to correct that. It will end on December 13.
Can you come closer to the mic, please?
It will end on December 13, the 83%. If it will go beyond that, then definitely that would be good. But by December 14, it will revert to 55%. If the President will extend the PHE to October, then that means there is an additional 90 days
Right.
for 83% or 89.2%, which will end in December.
Which will end in December of
2022.
2022, right?
Yes.
Yes, 2022.
2022. And
right.
so January 1st, it will revert to 55%.
Right, it'll go back, and that's
Yes.
that's less for us unless we need to provide more funding for this area, a lot more funding to get the same kind of. Is there a cap on how much funding we can receive if we match, you know, a certain amount of matching?
Yes. We
Okay.
still have a cap. So for this fiscal year, it's 133,210,000.
Okay, yeah.
It increases based on Consumer's Price Index every year. So kind of calculated for next fiscal year, maybe an additional 4%.
Okay, so in order for us to, let's say 55, you know, back to the 55-45,
if it reverts to that, how much funding does the government of Guam need to provide for matching in order to get the 120 match, I mean the 120 cap?
Okay, if it will end on December 13,
Right.
okay, my projection based on the increase on income guideline and based on the additional services that we just included under the program, we will need an additional 19 million.
Oh, that's what you mentioned earlier, but
Yes.
you're relying on lapses, correct? Or
Yes.
Okay, okay, so that's the same thing. So 19 million.
Sorry, Senator. The 19 million does not include the FY 2022 lapses.
Right, okay. The 19 million does not include the FY22 lapses. But earlier you were mentioning to us, or can somebody tell me how much lapses do you have for FY21?
We're currently evaluating that amount at this time.
What?
We are currently looking into that at this time.
Oh, it was asked
On
earlier.
2021.
Is there anyone that, Mr. Director, where's Mr. Taitigui? Is he still with Public Health?
Mr. Tardigo has since retired, and
Oh, he's retired.
Arlene is
I
now
see.
leading the finance office. She's our controller.
So you don't have the amount of lapses. Did you have the lapses? Do you have the number for the 12 million for 22 for lapses? I heard it was.
We're still working on it, ma'am.
It's something that we're really going to need. This body's going to know how much money that you still have in lapses in order to, go into the next budget for 2023. Do you know if
Understand.
there's anything on 21?
We need to do.
Not 20, I'm sorry, 2020, sorry. You have 2020 lapses that do you know how much is there and has that been expended? Because sometimes agencies will have lapses from 1 year. And then they'll just and the legislature gives the authority for you to continue, to carry over those lapses. And then you come into the next year, let's say 2021, and then you have lapses, to be carried over to there. It's almost, we don't even know how much money in lapses you really have from prior year obligations. So this is the only way, seriously, the audit report will only tell us what you spent. It will not tell us what lapses you have. So if you received $100 million, you spent 80 million, then we can only assume that you have 20 million left over.
Yes.
Right, so, but I'd like to hear it from the agency themselves on exactly how much those lapses would be. So if we can get a 2021 report on lapses, I think Speaker mentioned 12, but then earlier Tess said something about 7 million. So kind of not sure.
No, the 7 million is the 7 million if the FY 2021 and 2022 lapse funding will carry over, then the 19 million shortfall will go down.
So it is 12, like the speaker said, $12 million in shortfall, 7 million. That's the tentatively, right?
Yes.
For, I think this is Arlene, right? Arlene? Okay. So we'll get those numbers and find out exactly how much 12 million. So we hopefully, Tess, I'm sure you want us to save that lapse to cover any shortfall, but it's good to know exactly how much we have, but and not rely on the 8317, because that's going to be short-lived from what I gather on articles in the paper and especially these reports I'm getting from NCSL. How much in ARP funding has been spent at public health for salaries, and have any of them been given raises? Is the ARP funding been used for raises? Like, for instance, the nurses. Public health does have nurses on staff, and how much did that, since the nurses increase came into play, how much money did it cost the department additional for FY22? For those nurses increase. Zenny, or do you have that number, or somebody? Yeah.
Right now, for the ARPA, we spent about 1.1 million on overtime, and that's for COVID operations. And part of that number, there's funding for 4 social workers for DCW that we're currently going through at this time.
Arlene, I believe you received about $11,986,000 from the governor's ARP funding, correct?
That's correct. And we
Okay.
spent, I'm sorry, we spent 9.3 million, and out of 9.3 million, 1.1 was on personnel.
On personnel. Any of
Yes.
those, did you use the funding for the nurses' pay raise? Did you cover it?
And the
those-
nurses' pay raise is under a separate, it's in the general fund, under a separate account. In this ARPA, we have funded the nurses' pay for overtime. We didn't pay, the pay adjustments came from the local funds in the
Okay,
general fund.
that was my
Separate and
question.
apart.
Okay,
Yes.
so that was my question.
Oh, there's no pay raises from the
Okay.
ARPA at all.
Okay. And 1.1 was for overtime?
That, a majority of that number is overtime, and overtime is still ongoing for COVID-19 operations.
Okay. You spent 9.3, so what is the remaining?
Yes, the 8.2 million is from senior citizen and the Division of Children's Wellness, and Division of General and Administrative. For part of it is we had COVID test kits that we ordered that's encumbered at this time, and we have payouts for in the senior citizen activities, and as well as the Division of Children's Wellness.
Mr. Director, can we get a copy of those expenditures, please, for us, so we can see where that money went to and how it was spent?
Yes.
Okay,
Okay.
we'll have
But it's
to,
in the slide.
Appreciate it, thank you.
No,
Also, you
may-
have about $2,478,000 of balance in ARP funding that has not yet been,
Yes, that's
spent.
on, we will use that on September 30. Yes, that's correct.
okay, and what do you
Yes.
plan to use that $2 million for? Is
Every-
it the
yes.
overtime again?
Overtime is ongoing, it's very fluid, as
Okay.
well as DSC and DCW. They're pretty fluid every month, and they're pending contracts at this time with the AG's office.
Okay.
And that's why it's showing as available, but they're all reserved for.
Okay, so about 2.4 million is what I'm
About-
showing here.
about,
Okay,
yes.
and that being said, we can assume that by FY22, the end of FY22, all this money will be expended. So my next question is, are you planning on getting any additional ARP funding from the governor?
at this time, no, we have not made any requests, but I wanted to go back to your request for ARPA funding breakdown, Senator.
Sure.
In our slides, we already have a general breakdown, and it has like overtime and adult daycare and foster care services. Will that be sufficient to meet your request in the slide?
Yes, it would be
Okay.
very helpful, just
Okay,
to,
so
thank
we
you.
have that here. We just wanted to double check to make sure we provided you what you're requesting, Senator.
Mr.
And-
Director, the governor has reserves and for the Department of Public Health. It's about 13 million, and I'm not, give or take, that's been in reserves. How has that worked out for you? When money has been set aside where you can use it, especially when it comes to MIP or any other areas. In fact, there's a list of what areas those reserves are being taken from your allotment and placed into these accounts, these reserves accounts. It's about $13 million. Do you see that? When do you finally, that money is released to you guys?
What is your question?
When is that money finally released to you? Because right now, I'm showing in the records right now, there's $13 million of public health money that's been set aside in reserves. So that means you're not getting your full allotment, it's being set aside. My question is, when do you see those reserves? When do they come to you? Is it like in July, August, and?
Yes, majority of those money that are on reserve are for local matches. For example, DSC gets their grant at this time, and there's a match for that, as well as the Medicaid MIP. That's we're working on transferring those into the proper accounts to match the federal grants that we've received.
Yeah, I do see MIP payment revolving fund that has been set aside. That's probably 1.6 million for MIP. I'm just wondering, Tess, when do you usually see that reserve fund? I mean, right now they put 1.6 million aside.
That's on this.
Are you turn on your mic, please?
Oh, sorry. Yeah. That's on reserve, but anytime we need it, we request for its release. So we modify the account. If it's needed.
This also includes the Healthy Futures Fund, which they have, this is the largest amount that they put in
Yes.
reserves. It's about $7 million. And this covers MIP, cancer screening, Medicaid match, Guam Cancer Registry, medicines, and vacant positions. So when do you, Mr. Director, do you ask for that $7 million?
Well, we asked for it as we need it, Senator. I haven't had any negative response at this time. Arlene and I have already agreed that any and all funds that she needs, she would give me a minimum of 4 to 6 weeks in the event there's any challenge. But as Chief Administrator Tessa said, when we need the MIP funding to make good on our payment, we make the request, we do the modification, and the funds are released. We haven't had any holdbacks on our reserve at this time. Again, to the controller's point, when the Division of Senior Citizens notice of awards come in, I think they just came in with Shirley in April? Late April or sometime in April. That's when we'll make the request for those funds in reserve to match the grant award, and then the funds are released. You know, and you talk about recruitment, and actually I know that we have this 39 vacancy, but many of the other divisions are on track with their recruitment. And again, it's not holding back the recruitment process at this time. You know, that's what I'm experiencing. I don't know if the deputy is having anything different. Yeah.
Okay.
So it's a system that's there. We need the funds, we make the request, and modify, and then we get the funds released.
Okay.
Okay.
The other question I have is the prior year obligations. Do you have any prior year obligations? Arlene, you're up.
Yes, we do. We have some probably CWA.
CWA?
Yeah, for several people that we're looking into at this time. And it's the wages, the Competitive Wage
Okay,
Act.
cool. Yeah,
Yes.
competitive wage
Yes,
act.
and
Okay.
we're also looking at our liabilities at this time and going back to our payables to reconcile what's due from the prior year to address it.
You don't have those numbers with you?
No, ma'am, I don't have it with me. I'm
So,
sorry, we're very
Mr.
short-staffed at the office.
And you're brand new,
Yes,
too.
We don't have
So-
Tommy, so.
Welcome to the firing range, my friend. Well, true. Mr. Director, if we can get those numbers, that would be very helpful to let us know.
We'll get
Yes,
it for
we will be surveying the divisions to provide us their prior year obligations and compile that.
Okay. You know, I was able to pull from your budget that was provided to the senators that was stamped by BBMR as certified, right? And I even went ahead and did my own, chart on staffing. It was talked about earlier. And then I looked at the governor's summary, the comparative for the Government of Guam fiscal year budget. And of course, it just shocked me on seeing that the governor's for FY23 is requesting for 626 FTEs, and then, but public health, what is the amount? Okay, so I'm showing here FTEs for for the governor's request, 626. Is that correct? Because today's presentation was different from what the budget that you provided the senators. As I created my own graph chart based on your budget, it's quite different from what you presented. For instance, on like environmental health with Tom's department, it says here 35 special funds for FY23, 35 positions under special funds. So Tom, what is the amount of staffing do you have under your department?
Senator,
Warm bodies versus vacancies. Yeah.
well, first of all, Speaker,
Or
Senator,
Senator.
sorry, my apology. The certified budget that was submitted by BBMR, we acknowledge there is error in account for DEH, so we do acknowledge that the number is off. In terms of the number on the fiscal year 2023, I'm sorry, 2022, I'll start with that. There are actually, I'm sorry, let's start with 2022. There are total of 32, but of that, 3 are federally funded, so that leaves total of 29. And for fiscal year 23, we are asking for 26.
Yeah. Totally different.
So right, so there are definitely an error in the certified BBMR document, and we acknowledge that we miscounted.
Yeah. Then that it's actually the same for all of them, down from general admissions to public welfare, public health, senior citizen, child one. I come up with a total of 322 positions, which is, so it's obviously there's a mistake. Do you go back to BBMR to adjust and get a certified copy? Because all budgets that are submitted must be certified by BBMR.
Senator, I'd like to explain that we went back and counted it as well. And total filled for all the funds presented is 357, and out of that, 262 are filled.
Arlene, can you say that again? Of the warm bodies versus vacancies.
Right. So the 357 that we counted, we got to verify it. I mean, we identified that was.
Okay.
Yeah.
I'm sure. Mr. Director, if we can get those numbers to the speaker, so the oversight chair, and I'm sure she'll share these numbers with us as we go through the budget. But I just see such a huge increase, and I don't know if it has to do with the child welfare department, the children wellness and the new department, but it's showing in FY22, it was 474 FTEs, and then the governor's request, which I assume is probably your request, is asking for 626 FTEs.
Yeah, we'll definitely.
Quite large.
Madam Senator, we'll definitely look at that only because I know like less than a month ago I asked for how many warm bodies we had, and I was told 576. And so this is more in that range of 626 if you take the vacancies. If you have 39 vacancies in one division and you have 576, you're already going to be hitting over 600 positions. But we will look at this closer and update the numbers and provide that to the chair, the speaker. Yes, the chair.
The chair and the speaker, yes.
Provide it to my
Chair.
committee.
To you, to your committee, sir.
If you want, you can CC to the speaker your oversight.
Yeah.
But we're in a budget hearing.
Right.
So you make sure I get it. If I don't get it, then don't expect any results. Okay?
Okay.
Thank you.
Well, Arlene, did you want to say something?
If I may add that the 626 here is probably all fund types to include federally funded grants at 100%, not just local match.
Because in this budget request, we also have a 100% federally funded staffing patterns.
Right.
So those staffing patterns are incorporated. We're clearly at 600 plus. We have the Division of Public Health that is predominantly funded through federal programs. And so like they're asking for 80 positions in FY 2023, I believe, Xenia. But she's got over 400 employees under the Division of Public Health that are primarily under either grants or program income. As an example, the Community Health Center has no funding requests in this budget simply because they are funded through grants or program income. And so there's an easy over 100 employees at the Community Health Center, north and south, everybody from our admin team to our nurses, our physicians. Probably about 80 to 100 people just working there. And so if you take the total number of employees working for public health and social services, 626 would probably be the number, but we will verify that number.
I appreciate it, especially when it comes from the general fund, because that's where
Absolutely.
really the That's where it's going to be hard to pull teeth on is the general fund.
All right.
You know,
Thank
and I
you.
greatly appreciate all the hard work you're doing in trying to find these federal funds out there too, and you know, doing everything you can to sustain that as well by every year, you know, or every 2 years, requesting for an extension or, you know, a new funding, federal funding program. So you guys, my hat's off to you on that. It's a lot of work. I realize it's a whole lot of work, and I just want you to know I appreciate it and ask that you please provide those sentiments to everyone at Public Health, doing an excellent job there as well as they can, especially during this pandemic. You know, adonko lucy dusmasi, and please extend that to the staff at the Department of Public Health. Thank you so much. Thank you, Mr. Chair.
Thank you, Senator Tello. Senator Toniata, do you have any questions for the panel?
Thank you, Mr. Chair. Sure, I have a couple of questions. Thank you, Director Agustin, and to your team here for presenting your budget request for 2023. I have just a couple of questions here on your prior year obligations. It was mentioned about the CWA, the Competitive Wage Act. Do you have any outstanding rental obligations?
We do. We are working, we had a recent meeting with the Department of Administration. We're seeking guidance to address our current rental situation.
And what does that amount to?
The amount, I don't have the amount in front of me. I don't know. They're still reconciling the amount.
Is it upward of $500,000?
I would estimate that it probably is.
How about vendor payments?
Vendor payments, I would lean over to my division heads or my controller.
Or medical supplies, anything like that?
Tess is saying basically that we're pretty good on
equipment.
MIP payments, Senator. We're pretty good. It's our biggest concern right now is rental, and prior obligation would be the Competitive Wage Act.
So those are pretty much the two highest.
The two highest probably. We do have some perhaps personnel compensation that is due. Again, CWA would be considered a personnel compensation that we would have to meet that obligation.
I see, okay. And so all these are already all contractual that are being paid out?
With regards
So
just want to follow, Senator.
for rental?
Well, that's
those
what
are
we're
current
reconciling.
contracts.
Yeah, we're reconciling that situation, sir.
I see, okay. And then on the ARP, did you guys hire anyone under ARP funding?
Yes, we did. The controller was sharing earlier that I believe we have 5 positions hired under that, 4 social workers in the Division of Children's Wellness, and I believe we have 1 person under the Incident Command Response.
Okay, and then of those positions that were hired under ARP, does any of those positions translate into the current budget that you presented to us, or so you carried them on into this budget, or is their term limited and it ends when this funding ends?
Yeah, from what I understand, Senator, those positions will be carried under the Division of Children's Wellness for the social workers. The ones that are specific to COVID response, that position may not, depending on where we are with the PHE.
Yeah, you see that, and I recall in the last year's budget hearings, I was asking about ARP, and agencies that came forward, they said they don't plan to hire using ARP funding, and then transferring it over to general fund because we may not be able to absorb that. So of those positions, how much does that equate to in funding?
Our controller will pull that information out. We hired 2 SW1s and 2 SW2s, correct? Yes. 4 positions, and we can get that, right, social work position. We can get that, our controller will be pulling that out, that information, and sharing it with us.
Thank you. And then it was mentioned earlier about the Regala House now being operational. What was the holdup for the past 2.5 years? You said it was just operational the past couple of months?
Senator, no, I didn't say the last couple of months at all. I said it's been up for several months.
Oh, okay. So coupled to several. How
Yeah,
long is several months?
But I do apologize, and I don't know if it's the mask or the acoustics in this room, but I have to really listen diligently when each one of you speak. Yeah, it's been up for several months.
And so how many months is several?
I would say I don't know, probably well over a year.
Over a year?
Yeah, I would say over a year. Because when the process first began, and it was moving along well, and then there was a little bit of a issue, and so it had to be reissued through GSA. We knew that we had to stand that shelter up. It's a beautiful shelter, perfectly lit. We've invested quite a bit into it, and it's fully functional with the stoves and washers and refrigerators, and we made sure everything was installed. Worked very close with our teams out there to make sure that everything was operational, especially pumps for water pressure and so forth.
Oh.
So we definitely wanted to make sure that that place opened up, and it's been up for quite some time.
Okay, that's great to hear. On the issue of hold up here, let me I know a while back when we had a hearing, we were talking about signatures that were utilized that were not authorized. Have you guys did like internal securities to ensure none of that happens again?
What do you say? I'm sorry. So
Could
you clarify? You say signatures that were not authorized.
Right. During the hearing on one of the previous bills,
Okay.
that it was mentioned that a doctor's or physician's signature was utilized but not authorized. So I'm just wondering if you guys' internal securities now are, more tightened.
Okay, I don't know if I was at that hearing, but current practice is the physicians will only sign for those patients that are under their care.
Yeah, I think it was for results of the COVID.
Oh, okay.
The COVID.
So yes, we know, we have since resolved that situation with regards to the physician signing up. We
Yeah.
have our interim chief medical advisor, director, Dr. Bob LG right now.
Okay, so that was all taken care of.
Okay.
All right.
But if I may,
Oh,
Chair,
sure.
we do have that information Senator Ada was asking
Okay.
with regards to the ARP. It is for 2 social worker 1 and 2 social worker 2 positions for a total of 4 positions. And the total amount for the 4 positions combined is, for salary, is $296,390.
And that's salary and benefits?
Benefits that's just salary. Benefits right now, that's huge.
That's a combination of overtime.
Yeah, the benefits are, that is 296 is the 4 positions. We don't have the benefits because benefits right now in the system is including others, including overtime.
Okay.
Yeah. Excuse me.
All right. Well, all the other questions were asked already by my colleagues, so I truly appreciate your time here. Thank you for all the work that you guys do. Thank you. Thank you, Mr. Chairman.
Thank you, Senator Ada. Senator Duenas, do you have any questions, sir?
Mr. Chairman, and welcome to Team Public Health and Social Services. Thank you for being here this afternoon. Like my colleague just mentioned, many of the detailed questions were asked, so I just got a couple that I want to hone in on here. And it's what's been presented as the kind of the newly established, I guess. So on the Grants Management Office, what's the funding source on that, Art?
Well, right now, that grant management office was written in one of our grants. It's the health disparity grant. And so it's 100% federal. The team is working alongside our HR team and our FMF financial management team, as well as the GMO team, which is our grants management office. We're going to be developing a cost pool, and that's actually in consultation already and has been approved in terms of the flow and the process we're using with the Association of State and Territorial Health Officials, in which they're providing us technical assistance. So in the future, what you'll find is that these offices will be cost pooled in support of procurement, recruitment, and grants management.
Okay, so does the current funding source, does it expire?
The current funding source will have an expiration date. I believe it's good for 2 years. I will need to double check that.
Okay, so I just want to be a little bit more clear on the Grants Management Office. Do they apply for grants, or do they do reporting requirements?
Actually, it's interesting. One of the staff in that program actually wrote some of the grants for public health and social services. But in terms of their eventual function, they're going to be working on tracking performance, expenditures. They're going to be working on the establishments of accounts. They'll be completing the federal financial reports, the SF 425, and other grant-related items, including perhaps conversations, discussions, and training. Like, for example, right now they have been able to coordinate with GCC for public health to undergo training for Module 1, which is required for everyone who's doing procurement activities. So this is going to be our in-house kind of clearinghouse. They're also going to be eventually the ones responsible to ensure that the program manager is really doing program work. And so we don't have our program coordinators as program managers worrying about procuring services and goods. We'll have that done by GMO and the FMS office and HR office. What they can then focus on is really working out the target group, reaching to the target population, ensuring deliverables are achieved, perhaps even doing spot check, monitoring, evaluations, and program refinement and development.
Okay. So would you be eventually then requesting local funding source for that?
Well, you know what it is right now, and this is where we're still reconciling the numbers, is that we already have local funding for the director's office. What we hope to achieve is some of those local dollars will continue to be a part, because not all the programs are federally funded. For example, MIP is a locally funded program, so we really shouldn't be charging federal programs for that activity. So we'll need to do a cost pool of local funding to some degree based on operations and values of grants, and also in terms of the grants themselves. So it'll be two funding sources, your federal grants and some local dollars.
So standard operating procedures, SOPs, everything already established for this newly formulated division?
For this new formulated office, they are in their infancy stage. They just got created in June of 2021. And so this coming month will be their first year. So they're also reaching out to other existing grant management offices already and what their SOPs are, and they're developing it. That's why we're also receiving technical assistance and guidance from AASHTO, because they've helped other states and territories develop their GMO, their grants management office. So we see this as a way perhaps to track so that we can see which of our grants are performing well, which of our grants are needing some help, and then which grants are kind of like, oh my gosh, we really got to step up and help you. It might be recruitment, it might be procurement, it might be reports that have not yet been submitted. So they're there to support, but also to provide technical assistance.
Yeah, I can understand, and I understand the work associated. I just want to see where it falls in line with clearinghouse and other, duplicity in terms of this type.
Yeah.
It's going to be incumbent upon us to follow every time I see newly formulated or
So let me
newly
share with
established.
you.
I just want to make sure that there's that accountability and follow.
Yes, there is. And they're also going to be looking at proposed staffing for the grants. So that for example, in our one division, we have a shared position, which works really well. In other grants, they have their own admin staff. So we really want to look at how we can support the grant for everything that it's supposed to do in terms of reporting and requirements, but also really focus the grants in terms of delivery of services, be it education or supplies and goods and services to the people that we serve.
So you're looking at staffing this it's established under the director's office? Are those classified or unclassified?
No, they're classified. We're doing classified employees. Yeah, it's very hard to get unclassified has its place and its purpose and its benefit, but it's really hard for long-term planning to have an unclassified like an LTA or TA, and many of you may be familiar with that, but we do have to renew those individuals.
Okay. Well, we'll track as that goes along, probably
Thank you.
in some more detailed opportunities to meet with public health. We'll see how that's going forward. Like I said, whatever I see newly established, it doesn't mean that it's bad. It just means that and we want to see where the accountability is built in there, how it's funded, particularly when we're using federal funds and then having to rely on general fund to subsidize it.
And when I speak to the grants team, Senator, really one of the things I'm asking them to do is really to work with our grant managers so that we can improve our output, we can improve our production, and we can improve our level of spending. Because our level of spending will then translate to goods and services, and the goods and services that we acquire through these various grants that are managed by Public Health and Social Services can then translate into improve health outcomes for the general community.
Sure. And just the reason why, too, is normally when we see these grants management and opportunities, you're looking at applying, you're looking at the internal controls, you're looking at the reporting and the like. And so those kind of things I can understand. I think that if it's a function of the grant as a standalone, we're going to want to follow through on that and see where the where the return is. That's what I'm familiar with a lot of the way the federal government.
I do want to share with you, Senator, and then the rest of the committee, we are working closely also with the clearinghouse, and we find that it really complements the efforts of the clearinghouse. And so they've actually supported us, and we support them. Thank you.
So moving forward, once again, on the newly established, or at least established, because this has come to the, I'm sure the committee chair, there's been a number of budgets that have come across now whereby we're dealing with it from the basis of the establishment under executive order. So on the DCW, via the executive order 2021-026, I think this is probably why the chairman was asking this earlier, because if we go to your staffing pattern request, we've got a total of 138 current positions authorized to 79 and 59 to fill. So since it's established under executive order, was it relying on the DPHSS to fund these positions, or was there funding that came along with it?
Hi. So the 79 positions, it is broken down between federally funded through a federal grant, the Title 20 grant, and partially the CPS portion and the foster care is locally funded. So, excuse me. So, yes, it's a mixture of funding, but we're here today to ask for the support for the CPS and the foster care staffing.
So the CPS and the foster care staffing is in addition to your FY22 request? Because I don't see it broken out. I mean, I don't know that I was expecting to see it broken out in this exact PowerPoint. Maybe it's comprised of the grand total request in terms of authorized versus request. But so the request is now coming in the 2023 budget, although this was established under executive order on January 1, 2022.
Correct. So the numbers were maintained from FY22 for the staffing, but we had many, many vacancies. So when the newly established division was started in January, we've received funding with the support of ARPA. And then also, we are also working, under the division, there's also the Bureau of Child Care Services that is sharing the cost of some of the staff that assists with the Child Abuse and Neglect Registry, because it works hand in hand. So we have been trying to find the funding to support the other staff. So we have onboarded several new ones.
Okay. Yeah, I think that's where we're going to really have to work with the chairman. I don't have any issues in terms of trying to ascertain what the veracity of these programs and the services being discussed. Because we're talking about also drifting between contractual and non-contractual. Maybe to go back to Terry real quick. Terry, my understanding was you're also sharing employees from Department of Youth Affairs for the operation up at, we call it Regalo House because that's what many of us who contributed and helped get it done.
That shelter's has had many names. It's
Yes.
the Regalo House, it's Kumamaasi, it's Sister Bridget Home. It's, it's even been called Ali Shelter 3.
Right.
Yes, what we did was we had, through Executive Order 2021-02, that allowed the Department of Youth Affairs to partner with Public Health and take a lead role in helping us revamp and reorganize Child Protective Services. And so that was an excellent partnership. We are actually in the process of transitioning more of their staff back to DYA. What we did, and when we stood up the shelter, and we did get clarification, it's actually been almost 8 months that the shelter's been up. So it is the better part of a year, but not quite a year. We did utilize some of the staff over at the Bureau of Social Services Administration, and we had the good fortune of using some of the DYA staff as well. And then what we did was we went ahead and opened up and hired limited term appointments. And we've been using community program aides and making sure that they were onboarded and trained well. And then, of course, we use some of our regular BOSA staff too that help do some mentorship and some guidance as far as teamwork approach up at the shelter. So we did pick up, originally I think we interviewed for like 29. Actually, I think there were 19 that expressed an interest, and I think we'll end up getting about 13 limited term appointment staff to help operate the facility on a 24-hour basis.
So, Art, I don't know, this is Terry's question still, but on the overall budget, because this is where I'm getting a little bit mixed up. So I know that the design for this particular shelter was designed to be contractual, but there's been a discussion that there's been difficulty in terms of the procurement of the contract. So is it included also in contractual? Do you intend to go out on contract, or do you intend to now run it under DCW?
Go ahead. Right now, we're still moving forward with the contractual. Like I mentioned earlier, it is at the AG's office for their review. And as long as it moves to the AG's office, then that has been part of the goal. We have found that with the shelter under the government of Guam, it actually makes it easier, convenient to be able to work with the staff there and making sure that our social workers visit the children on a regular basis, because many of them are court cases.
I understand that, but I'm going to disagree with you. I think the private sector does a really good job.
I think they do too, but we never said they didn't.
So Senator, to your question, I do agree that the Deputy Director, that we are pursuing the procurement activity to outsource the shelter.
Thank you. Yeah, so that's
the
where...
current situation is the interim period until we get that shelter outsourced.
So that's where we're going to have to reconcile, this, because the situation on the staffing request here, I think our chairman might share this concern, and I want to make sure we sort this out in this budget. Executive orders are wonderful devices, and they're very useful tools in terms of being able to do things with alacrity. But the procurement process, but the budgeting process is here. This is where we do that so that there's sustainability for the operations going forward. Because when this is done, we need to find out what are the funding sources, how does that money get transferred, and how does it become now our responsibility in the overall grand scheme of budgeting to make sure that we now absorb, because that's what's obviously happening. The funding source that established the executive order came from a variety of different sources, ARP. My colleague asked a question earlier, are we absorbing employees moving over from ARP in? It looks like we are. And so if we're doing that, we've got to account for that. We've got to account for the fact that we are now, bringing on more FTEs that are going to be reliant on the general fund. And that's something that, we certainly have to determine what are the needs for those programs, but also the sustainability going forward in terms of the overall. That's why I needed these detailed questions on these establishments by executive order. So we'll review that with the chairman as we go through the process and the like, but thank you for the detailed information. But Art, I highly encourage you. We got sanctuary. We have so many examples of really, really outstanding operations under contractual. I know probably Catholic Social Services or others, may be in line to really do that work that they're really good at, and that really is more helpful to the government in terms of public-private partnerships. So I look forward to that process going forward. Mr. Chairman, with that, at this time, I don't really have any more detailed questions, but we'll certainly have to take a look at a number of things going forward. So just Marcy.
Thank you, Senator Edson. And yes, we do need to take a look at the numbers one more time. Senator Perez, do you have any questions for the panel?
Thank you, Mr. Chair. A lot of my colleagues asked a lot of the detailed questions earlier. I just have a couple. So do you see a need to fund positions in which the federal grants are going to be sunsetting? And how many positions are being affected?
That's something Senator Perez I would have to do an internal survey with, because if more often than not, if their position is going to sunset, then the plan is that there would have been a transition in that effort to absorb those functions. So I don't know that we have any positions listed right now that sunset that we are going to be pushing forth to maintain under any other funding source other than the grant. But I can definitely check with the division heads. It's not they're all sitting here and we can have a meeting post-budget and provide you a response.
Yeah, because I was approached by some employees, and they were concerned that they were one of the frontliners in testing many of the community, and so they're concerned about potentially the lack of a position, considering that they were so important to our the health of the community.
Right. Thank you. I will check on that, Senator.
The other thing is, I know there was some mention, at least in one of the presentations, regarding federal grants. I just wanted to maybe ask each of the division heads if they can at least kind of provide what is their federal fundings outside of what is requested in the budget for matching. So if that could be provided either now or at a later time, a total amount of federal funds.
Senator, I want to be clear on your inquiry. You're asking for an inventory of programs that require matching that are not in the budget?
No, the opposite. Basically, federal funds that are not listed in the budget, that doesn't require matching.
So you 100% federally funded programs that are not in the budget?
Yes.
Okay, got it. Okay.
The other thing is so the Division of Children's Welfare, I think, is such an important division. Of course, all the divisions are important, but considering that my background is in education, and I see such a huge need in early childhood care, early intervention, and I'm just kind of curious to see what is the plan for this, the use of these funds, and if there's a plan to expand this program.
Division of Children's Wellness, you wanted expansion and what the group would be, the future outlook?
Currently under DCW, I know we're talking heavily on the Bureau of Social Services Administration, but within the division, there is the Preschool Development Grant, Birth to 5. It is a systems grant that does assist like the Guam Early Intervention System, Head Start, Early Childhood Special Education. So that grant specifically works for early childhood care programs. And then on the other side, we also have the Bureau of Child Care Services, another federally funded program that does assist, that pays for subsidies for child care, for children to attend child care facilities. So that right now we're working on big initiatives to push out a lot of our federal funding that we received to increase eligibility for more children to attend child care facilities, as well as to increase workforce and get them training, to even recruit many relative care providers so that they can take care of the children, that grandma and grandpa can take care of children at home. So that's how the additional services we're providing to our children.
Mm-hmm. What about prenatal care? So there's, youth that are in the school system perhaps that become pregnant.
Yeah. So
what part of that?
Hi, Senator. So we do have a program called Program Bisita that takes care of those needs, and so that's open to everyone.
Mm-hmm. Is that a general fund? Is it funded by the general fund, or are there other additional supplemental funds associated with that?
So the staff are federally funded, and so it is a federally funded program.
Yeah. Should I add to that? So, of course, in addition to that, we have the maternal and child health programs. And if we do have, perhaps, let's say, for example, a teen who's pregnant, then on the entry level, we can make sure that she has access to prenatal care as well as other services. And then as far as Zini had mentioned, we do have Project Bisita that actually has visiting home nurses. And those home nurses provide models in which the discussion around it can be around the bonding between a mother and her baby, or it can be around an array of different educational to help the new mom transition to motherhood. So it's an excellent program.
And what is your, how much do you serve, the numbers?
Senator, in addition to that, we do have our communal health centers that provide those services as well for the underserved. So they can go to either Northern or Southern. I don't have the numbers of how many we've served, but we can definitely get that to you.
Appreciate that. In regards to ethics and procurement training, is that included in this budget?
Most likely it is, yes.
Okay. And then also,
In the fiscal year 2022, we have sent several already in the department to attend the training.
okay, so that includes all employees of Department of Public Health?
Not all of it.
Not all?
Yeah.
Okay, yeah, it's a mandate. In regards to procurement, though, how many staff have completed the procurement modules?
Senator, we'd have to get that number from the various divisions and provide that to you. I know that we have currently a class in which we have individuals taking Module 1. I know that we've also lost some individuals that completed all 4 modules with retirement, promotions, and separations from public health and social services. But I'll have to survey with our team, our division heads here, to assess how many of our employees, and we do have somebody managing this over in the director's office. So I'm not sure if she's hearing us at this time, if she has, with regards to maybe how many have already completed all 4 modules. I'm asked them to give us information. They probably don't have that right now, so we'll have to get that to you. You're looking for all those who completed all 4 modules?
Yes.
Okay.
Yeah, I just want to basically encourage that, because in order to do procurement in a timely fashion, I think it's really important to have the trained individuals. First of all, it's required by law for those that are engaging in procurement, and secondly, it can also help streamline the procurement. The other thing is contractual services. So can you provide a breakdown on the increase? I know initially there was a question earlier by the speaker in that the increase from the Division of Senior Citizens, but are there other things contributing to the increase in contractual services?
Let's look at the, sorry. Charlene, you have some comments on the contraction? So I'm going to have Charlene share with you what's happened in the Division of Senior Citizens. Senator, if I'm following your inquiry, under the summary for the department, you're saying there's an increase in contractual services. Is that correct?
Yes, according to the budget, there's an increase, a tripling of almost a tripling, I think, of the contractual
So
services.
in FY22, Charlene will share with you what's going on with regards to the funding for contractual services under the Division of Senior Citizens. And perhaps you can provide the Senator the amount of monies that are required under FY23.
Correct.
So is it all from the Division of Senior Citizens? Is that, okay, that's, yeah, because I know she explained it earlier, her part, but I'm just wondering where the other increases are due to.
Yeah, under the Division of Senior Citizens, Senator, in the summary, in FY22 we're at 4.6, but in FY23 we're at 13.3. And so there's a significant amount of funds that's about what, 9 million almost, or 8+ million, that is increased in terms of funding under 230 contractual services for services to the seniors.
Under contractual, we have under DGA about $387K for the fiscal year 2023. For public health, we're looking at $220K. Senior citizen, about $13.3 million. Environmental health, about $409K. Public welfare, $5.8 million, and children's wellness, $2.5 million. That makes up a total of $22.8 million.
Okay, so mostly then from Division of Senior Citizens then, it's a big portion.
Yes, but as you look at the Senator through the summaries, test here is also showing that under the Division of Public Welfare, under 230, Senator, we have an increase of almost 3.7, 3.8 million, and it's for systems development. And Tess, please, you're welcome to share more on that.
Yeah, we are actually enhancing the system to have online application processing, as well as for clients to be able to have a portal for them to be able to see their applications, to see what's the status of it, and at the same time also an online uploading of claims supporting documents for claims processing that's required, and additionally for TMSS transform Medicaid statistical information system.
Right. Thank you. That's worth the investment, I think. Okay, so I think that's all my questions for now. Thank you, Mr. Chair.
All right, thank you. Mr. Agustin, do you guys pay for space at the Hessler building or no?
There is utilities that is going to be assessed to us, and we met with the director.
Okay.
Yes. And
I was just curious about that. But anyway, what I'd like you to do is ask your staff to get with OB and do the final scrub so that many of the questions that my colleagues asked, let's show it in the report so that when the committee presents it to all my colleagues, everything that was discussed is in paper and they can actually go through it and it'll clean up whatever needs to be cleaned up or whatever needs to be reviewed, we review. And my biggest concern is that you have some lapse funds. The new comptroller, may God bless you. Go back, please, and take a look at anything that's lapsed. Try to use as much as you can now.
Absolutely.
Because our goal is to not continue always carrying over. It should have been the first funds used, not your current. Start using that old money and move forward with the new funds. Okay, and that's my only recommendation. Other than that, the committee will conclude this budget hearing. Committee will continue. Do you want to say something?
Actually, our controller would like to share some information to some of the inquiries earlier.
Oh,
Would that be
okay.
appropriate?
If you have all the answers, but I prefer that if you put it all together so that it can be shared by all the other colleagues. If you provide the report to the committee, any information you have, we can present it all to everyone, one shot. Okay? Because there's a lot of information I know, and then Tess is looking at me like, yeah, put it all together in a report. Let's get it all out so that my colleagues can get all the information and we'll be complete. And we'll wrap it all up.
Thank you very much.
Okay?
Okay.
And welcome to your new position. Like I said, God bless you. You got all these other folks that they've been doing this for decades. Okay? The committee will continue to receive testimony. Please address your written testimony to the Committee on General Government Operations, Appropriations, and Housing and submit it via email to Senator Joel San Agustin at gmail.com or to my office located at the Rancare building. For some of you, just downstairs from your office, the second floor, Suite 3, 761 Marine Corps Drive. Sus mas for your attendance and participating in today's hearing. And for those at home, thank you for watching. This budget hearing on Bill 276-36 COR relative to the Department of Public Health and Social Services is duly heard and is now adjourned. It is now 4:49. Thank you very much, and please drive safe and tell the folks, you guys, thank you for your services. Take care. Bye-bye.